Welcome all. Welcome to this AimExcellence NRMT question answer discussion. Here we are continuing again in the JQ plus mode. So apart from giving the answer, we are going to give you some important points too. So see this particular picture. This is a test strip which have been given out here. These strips are now used for quick diagnosis of which of the following. A is TB in HIV positive cases, B dengue, C malaria, D hepatitis B. So we are understanding by seeing the picture and the options that these particular strips are actually used to diagnose a infective case, and by seeing the picture which is marking antigen out here, we can easily figure out this is a antigen detection test. So what is the name of this particular strip? This name is LF-LAM, lateral flow lipoarabinomannan test. Lateral flow lipoarabinomannan test, which is a lipopolysaccharide which is present on the cell wall of tubercular bacteria. So we understand the answer of this particular question is TB in HIV positive cases. Now the question can emerge in mind. So when there are tests like sputum positivity test or chest x-ray, so where and when we are going to this particular test? That is a very pertinent question. You see this particular option that have been given out here, TB in HIV positive case. So this is a special scenario which emerged already. It is in HIV positive cases. We know at least 10% of the cases of the total TB cases, and 10% of the incident, roughly 10% of the incident of TB cases are also present with the HIV positive. HIV positivity. Those cases, the clinical presentation is not actually mimics the classical TB case presentation. So it is very difficult to clinically suspect that these are the cases of TB cases. So the sputum culture may not be done, and it will take time also. So in that particular scenario, the diagnosis can be missed. Here comes the LF-LAM test, which is actually done on the urine sample. It is done on the urine sample. So less infection control measure you can employ, because there are more chances of spreading of the infection from the sputum than the urine itself. And second important point that is very important, it actually gives the result whether it is positive or negative within the minutes. So these are the two important factors which helps it as a point of care test in a case of TB, particularly in a HIV positive case. But then why it is still not being employed as the general identification test? Because apart from TB positive cases, all TB positive cases in a HIV positive case, general TB positive cases doesn't give very encouraging result in terms of sensitivity and specificity. This is sensitivity and specificity in general TB cases is not that encouraging. So this is number one. And number two is the cost. Cost is almost $3 to $4 per strip. So this is for the developing country. It is a deterrent factor. If you like this presentation, continue to be with us, continue to follow us, and we are obviously going to upload few interesting MCQs, and be with us directly, follow YouTube itself, and write to us if you have any queries or doubts regarding any presentation. Please mention the timing so we can check that, when we can figure it out where is your problem, and then we will revert back to you within 72 hours. Thank you for being with us. Thank you for supporting us. We really appreciate your support. Thank you.